1, 2, 3 most important things about HRT.
Warning!
You're watching Dr. Todd Lee TV, where theoretically you could learn a bunch of cool shit.
Greetings, Earthlings! Like, subscribe, and share this video. Share with a friend. Share with enemies. Share with people who think they know everything. Spread it like herpes. Also, speaking of herpes, I am a medical doctor and I could be your doctor. That only requires you to click the link in the description box. I can order you blood work, I can read the blood work, I can treat any illnesses. Basically, it's like an HRT clinic that's a one-man army. Also, I do coaching. Dr. Karina Dodson and I have a coaching business called Apex Coaching. So if you sign up with me, you get coaching, which is nutrition, programming, competition prep, or lifestyle coaching, as well as all the medical stuff. So you have 3 people, 2 doctors in one business. Hello, everyone, and welcome to the Anabolic University. I am your professor, Dr. Todd Lee. I am a biochemist, a medical doctor, and an IFBB professional bodybuilder. And I'm going to talk about the 3 most important things about HRT. And what's funny is these are the 3 things I get the most pushback about. It's unbelievable how much people don't want to do the 3 most important things. These things do correlate to bodybuilding, but there's exceptions with bodybuilding. Bodybuilding's a little bit more complicated. But I will talk about HRT, and then I will put the corollary in for bodybuilding in a moment. Number 1, most important thing about HRT is to do your shots every single day. You would not believe how many people push back against this. It's unbelievable. And the bodybuilders, they're not the stubborn ones. They're like, yeah, I could totally see that because your levels are stable and you get less side effects. But no. Your average 40-year-old dude, he does not want to hear anything logical or intelligent. He just wants his feelings validated. I don't like needles, and that's a lot of effort, and I don't really take it that seriously. It's like, let me get this straight. You don't take it that seriously, but you want to run a bunch of Primo and Tren because they don't know that TRT is testosterone replacement therapy. It's not Trenbolone replacement therapy. It's not DECA replacement therapy. It's testosterone replacement therapy. If it ain't testosterone, it ain't TRT. Same thing, well, it's HRT. HRT is testosterone, thyroid, growth hormone replacement therapy. If you're not putting the hormones back in your body that aren't there, that need to be there, it ain't a replacement. That's not what these words mean. That it's English, and these are specific words. Testosterone replacement therapy. We replace the missing testosterone. Not extra. It's not extra testosterone therapy. It's testosterone replacement therapy. So if you're not a testosterone replacement therapy person, then you're an aspiring or a person who identifies as a bodybuilder. And if you have a card in your wallet that says IFBB or NPC, then you are an actual card-carrying bodybuilder. If you are on HRT from a doctor for low testosterone, you are an HRT patient. Everything in between, that's up to opinion. That it's not a fact that you're a bodybuilder, and it's not a fact you're just HRT. You're somewhere in this limbo where you get doctor's gear, but you use a bunch of other steroids. And you don't have a reason, you don't have anywhere to go. Doesn't matter when you get there, but you're going to hammer the nitrous. Doesn't make any sense to me. It's like, if I have a clear goal, and I'm like, I have this goal, and I have to hit it by this date, then I can be like, I'm behind schedule. Now is the time to use drugs to help me achieve that goal. Otherwise, I should be able to achieve it. Because all of the people that are just farting around with steroids, they don't have any goal. And if they do have a goal, it's like, I don't want to look like a bodybuilder. I just want to look great with my shirt off like one of the guys in the movies. It's like, they don't need steroids for that. You don't need steroids for that. You don't need a chainsaw to cut through bread. So why would you use steroids to accomplish a normal looking human physique? The only reason to try to use supernatural amounts of drugs to give yourself a supernatural amount of muscle and a supernaturally level of body fat is because you have a supernatural goal. But if you're trying to look natural, then you wouldn't use any drugs because you won't look natural. You'll just look weird. You'll look like you're in a bunch of drugs, but you did it wrong. So, that being said, all people, HRT, bodybuilders, and everything in between, should be doing one shot every single day. Your balls make testosterone every day. Your brain makes growth hormone every day, or your brain releases growth hormone every day. Why would you not do them every day? Makes no sense. None. Makes no sense at all. 0 cents. Makes no sense. And a lot of people will say, Todd Lee says if I shouldn't, no, I'm not entitled to bodybuild if I don't use GH. Or Todd Lee says if you don't do shots every day, you're not good enough to be a bodybuilder. That's not what I said at all. I'm saying that not doing it the right way is the wrong way, and it doesn't make any sense to do it the wrong way. It's not like there's differences of opinion. It's not like there's this group that says the pros are this, and this group that says the pros are that. There are no pros, like positives, to not doing it every day. There's only the right way to do it, and the right way to do it is every single day. Every day, every day, every single day. And a lot of people extrapolate the dumbest ideas, like Todd Lee says to do sub-Q. When did I say that? I never said to do sub-Q. That doesn't make any sense. Sub-Q is never better than intramuscular. But I thought sub-Q and no, you do intramuscular every single day. But I guess because he wants me to do it every day, I have to use Prop. No, don't do that. The whole point is to have stable levels. Prop's like this on a graph. It shoots up, then it crashes, and it shoots up, then it crashes, and it shoots up, then it crashes. Even if you do it every day, it's like that. It's terrible. Terrible drug. You want to have a nice, steady level. If you do it twice, it's like boom, boom. And that's where the mood swings come from. That's where the sleep disturbances come from. That's where the increased estrogen, that's where the acne, that's where the hair loss, that's where all your side effects come from. You're doing one shot every 3 days. But it doesn't matter. I'm trying to encourage you to do it the right way because I'm trying to help you. I'm not trying to hurt your feelings. I don't give a fuck about your feelings. I care about your health. That you can have feelings and be hurt when you're alive. But if you're dead, you don't get any feelings. So I'd rather you were alive and hated me than you were dead and didn't have any feelings at all. So therefore, just do it fucking right and do it shot every day. It's not hard. Use an insulin syringe. Load it up with the appropriate amount of drugs. So if you normally do 200 a week, one shot every 3 days, then do 20 milligrams every day. It's less drugs, but you'll get more out of it because less is being converted into the metabolites of estrogen or testosterone. DHT. And people will say, I thought if you do it sub-Q, you get less estrogen conversion. No. The idiots who did this study, they compared intramuscular twice a week with sub-Q every single day, and the fucktards concluded that the reason why you have less E2 conversion is because of sub-Q, not because you're doing it more frequently. That's why you can't trust these scientists and these idiots who read studies and like the studies say this, but they don't pay the money to read the whole study, and the whole study has a method section. And if you can read the method section, you find out that these guys who ran the study are morons. They ran the study like shit. Why didn't you compare intramuscular to sub-Q and then do a different leg and compare intramuscular to intramuscular more frequently and do a different leg that compared sub-Q to sub-Q frequently, and then take those 6 legs and compare the results from those 6 legs? Why did you just do 2 legs? It's because they don't have enough test subjects. They needed to have enough test subjects in each leg to make it statistically significant, because the clinical effects would be almost insignificant. It'd be like you get a 1% change, but it's statistically significant 1% change. So you can legally say, yes, there's a 1% change. And so they get to be published in some bullshit journal. But it's not clinically significant. Who cares? Like if you have a 36 as opposed to a 40, that's not going to have any impact. It's clinically insignificant change, even though it's statistically significant change. I'd rather have a statistically insignificant study that gave me a clear idea of what's going on, and then we can then focus that study like, okay, so we've got it clear that every day is better. But the question is everyday sub-Q better or is everyday intramuscular better? Now we do a second study, make the first study a pilot study, make the second study a real study, and have two legs that are just comparing sub-Q versus IM every day, the way it should be. And what you'll find is if you have a low body fat, your skin will be irritated and burn if you do it sub-Q. Only if you have a lot of body fat and cannot reach the muscle does the sub-Q make any sense. And there's people out there that it doesn't matter because it's so shallow, it just leaks in your body fat anyway. Why they're angry, I don't even know, because they clearly want it to be sub-Q and they're mad that you dare suggest someone do intramuscular. Fine, you got what you wanted. If you believe that the drugs leak sub-Q anyway, what are you pissed about? I think the reason why they're pissed is they're carrying so much body fat, they can't reach the muscle. So they're angry at you because you're making them feel bad about themselves because they're like, wait a minute, I can't reach the muscle. I'm too fat. So now I feel like I can't do it the right way because I'm too fat. And rather than accepting I'm too fat and I need to lose some body fat, I'm going to get mad at this person who made me feel fat. Because it's his fault I'm fat. It's not my fault I'm fat. I mean, like, I don't know how fat you have to be to where you can't go through the shoulder or the tricep and hit the muscle. I mean, that's pretty easy to do. But if you do get in the fat, it'll still absorb. You just can't run a lot of it. Now remember, HRT is hormone replacement therapy. A normal human man makes 15 milligrams of testosterone a day. So 15 milligrams a day is average. So if I say use 20 milligrams a day, if you're using cypionate is 70% testosterone, 30% the cypionate ester that's attached to carbon 17. It is not bioidentical because there's an ester attached to it. Don't let anyone tell you that testosterone is better for you because it's bioidentical. It's not bioidentical. There's a fucking huge 8-carbon molecule slapped on the end of it. It's not fucking bioidentical at all. Only an idiot thinks that the CYP is bioidentical. Now, it's more bioidentical than the other anabolic steroids, but it is synthetic. It's not like you're ripping it out of balls, you know. So anyway, oral steroids are done every day because of the short half-life, and injectables should be done every day, even with a long half-life. The whole point is to get a stable distribution. So this whole idea that you only have to do it every week or every 2 weeks, where this came from is doctors made it this way so that they could administer the shot. And they knew patients wouldn't come in every day for a shot. They would come in every 2 weeks for a shot. So they invented drugs like Testosterone that have like a big spike, then a little spike, then a smaller spike, then a smaller spike, and so that it basically is relatively level. Because otherwise, if they did SIP, their blood would be like this. And every time there's a peak, there's going to be conversion to estrogen DHT. And then every time it goes down, the estrogen's still there, but now you're depressed and you go hypermasculine, hyperfeminine, hypermasculine, hyperfeminine. So they shortened it to every week. Then they shortened it to every 4 days. And they're like, we can't expect people to use a giant hypodermic needle more than every 4 days. That's why you use an insulin syringe. Well, we can't expect people to use insulin syringes because they're too fat. Encourage people to lose fat so they can hit the fucking muscle. And by the way, it still works sub-Q. It does work sub-Q. It's not as good, but it still works. And if you're injecting GH every day anyway, what's the fucking difference? Which brings us to point number 2. GH, just like number 1 is do your test every day. Point 2 is it is dumb not to use GH if you're using testosterone. And a lot of people will say, Todd Lee said I'm not allowed to do bodybuilding if I don't use GH. I didn't fucking say that. I just said one without the other is pointless. It's like running on one leg. Keep in mind, your body makes testosterone and your body makes GH. So yes, the testosterone works because your body still has some GH in it. Yes, the GH will work because your body still has testosterone in it. But it's dumb to not at least have the average amount because the testosterone upregulates the GH receptor and the GH upregulates the testosterone's androgen receptor. So they work synergistically. And then the estrogen through the estrogen beta receptor, yes, on the muscle cell too, and the liver and the muscle converts the GH into IGF-1. So the IGF-1 and the androgen binding the androgen receptor is how muscle is built. I'd like to thank our sponsor, Fusion Regenerative Therapies, where I am the Director of Human Performance. This is the practice in which I practice medicine. We'll be able to order you blood work and read your blood work and help you with therapy as needed based upon the results of your blood work. Please click the link to get a consult with me, and I can help you optimize your performance. Thank you. Plus, GH has a benefit on fat loss. Testosterone has a benefit on fat loss. DHT has a benefit on fat loss, which, of course, testosterone is a precursor for DHT and estrogen. And estrogen, if it's within range, has a benefit on fat loss too. Having low estrogen, it's harder to lose fat. Having a high estrogen, it's also harder to lose fat. But having a normal amount of estrogen is the right way to lose fat. Now, I'm not saying you should just upregulate your testosterone and GH ad infinitum. You should run the correct amount to get the maximum benefit. This is where the magic happens, is that there's a certain point in you that's specific to you and just you. It's not the same for everyone. That your estrogen at a certain point maximizes the GH conversion to IGF-1. In some people, it's 6 milligrams and 6 picograms. In me, it's 100. If I go to 120, I get no more GH. Now, this is IGF-1 conversion. This is really easy, so I'm going to give it to you. If I do 106 units, and assuming I'm not using insulin, if I'm using 6 units of GH and I've got 100 estradiol, I get a 468 IGF-1. If that estradiol drops down to 80, I get 80% of that. It's linear. Right now, because I'm on prep, I intentionally brought my estrogen down to range because I wanted to get the fat off my ass, because estrogen makes you store fat on your ass and around your chest and the backs of your arms and the backs of your legs. All right? Not good. Not good as for a bodybuilder to have fat deposits. So I need to bring my estrogen down to a normal masculine range so that I can get the feminine fat deposits off. It's not because it's good for me. It's not because it's going to help me preserve muscle. It's purely cosmetic, because that's what bodybuilding is. At the end of the day, once you're the last 8 weeks, all that matters is looking good on stage. It's about conditioning and posing. All the muscles are already going to be built that's going to be built. You're not going to build any more muscle in 8 weeks. So you basically get, if I get my estrogen down to 30, I aimed for a 30, I got a 29. That's how good I am at getting the exact amount of estrogen I want at this phase from all the serial blood work I did to know exactly how to receptor map it out. So I know exactly how much test to use, and if I'm using a certain amount of test, how much Primo is going to blunt the estrogen conversion, because Primo is an AI, an aromatase inhibitor. And I was able to get my estrogen to a 29 when I was shooting for 30, almost a complete bullseye. And the result was a 273. Now I'm using 20 units of GH, but this is my point. It doesn't matter if I use 6, 8, 10, 12, 20, 26. I don't get any more IGF-1 than what my estrogen allows. And my estrogen stops being beneficial at 100. So once I go over 6GH, no more IGF-1. Once I go over 100 estradiol, no more IGF-1. So what that means is I should use exactly enough testosterone to get my IGF-1 to its maximum effect. I use the right amount of GH and the right amount of testosterone to get the right amount of estradiol, which gives me the right amount of IGF-1. You don't want to use extra test, because extra test converts to extra DHT and causes aldosterone to store extra water. The DHT causes hair loss and aggression. It doesn't really benefit strength, although people think it does. The aldosterone causes increase in blood pressure, and testosterone can directly cause an increase in red blood cell hematocrit hemoglobin. So there's downsides to overdosing on testosterone. I've seen people hit maximum effect with 20 milligrams a day. With me, because I have more muscle tissue and I've been using it for 15 years, I need 50 milligrams a day to get the maximum benefit of testosterone. So there's no point in me using more than 50 milligrams of testosterone, and no point in me using more than 6 units of GH. Now, I'm a professional bodybuilder, so I obviously need more than that to grow, but I use safer drugs like Masterone to do that. And I know people have told you that Primo is better than Masterone. That's because they're just repeating what they heard. My blood work and every blood work I've ever seen shows beyond a shadow of a doubt that Primo is either a mild AI or a moderate or a strong AI. And Masterone, I've never seen any aromatase inhibitor effect. So the only point of Primo is if you're using too much test, you need to bring down your estrogen level with Primo. If you're using too much test, Primo helps rescue you from using too much test. So only an idiot takes a drug to cover up the side effects of a different drug. Just lower the dose of the offending drug and use a safer drug. You have this all the time in bodybuilding, hopefully, and not in HRT, but you see in bodybuilding all the time. There's idiots using nandrolone, and then they use a bunch of drugs which cause brain damage and shit to protect them from the gyno that the nandrolone causes, rather than just using a drug that doesn't cause gyno. They're like, well, it makes you bigger. It's like, it makes you bigger because you're holding water because of the fact that it's upregulating the estrogen receptor. It's not actually making you bigger like you're growing more muscle. Maybe it is, but only like 5 or 10%. It's not worth it to have to use a bunch of other drugs. Because if it's 10%, that means like using 500 nandrolone is like using 550 test. You know, like, why? What's the point in that? It's not a safer drug. And yeah, it doesn't convert to DHT, but we're getting off topic. The point is, using GH is the second most important thing you can do for HRT. And the reason why I'm covering all these bases is because everybody and their brother who watches the internet to learn about steroids, they want to use more because they think more is better. It's not more is better. Using the right drugs is the right thing to do. So the third most important thing is don't use more tests than you need to. So I've covered most of that already. I kind of forgot to tell you we're on the third thing already. So the third most important thing is don't use more tests than you need to, because you have the increase in aldosterone, the increase in the DHT. Those are not beneficial. That the estrogen is the only beneficial thing from the testosterone, aside from it binding to the androgen receptor itself. But once you start, what a lot of people are concerned with on the internet, these influencers, they're concerned that by me telling you that estrogen can help build muscle directly through it binding to the estrogen beta receptor on the muscle cell and causing an increase in IGF-1, or binding to the liver and increasing IGF-1 that way, that people will intentionally somehow drive their estrogen through the roof. That's why I'm making it very clear the third most important thing is not using more testosterone than you need to get exactly the amount of estrogen you need to get the job done. And that's something that they need to point out to me, and that I don't deal with, but other people do, is before other people hit that point of maximum return on IGF-1 for estrogen, they start running into estrogenic side effects because they're only using HRT doses. If you're running enough Masterone, because the androgen load is so high, 50 or 100 estrogen doesn't matter because you're running this much androgens. So the androgen to estrogen ratio is so good, you don't have to worry about gyno or estrogen mediated side effects. But for people that are running like 50 tests and getting 100 estradiol, they're basically not, they don't have very much androgen load. They have 350 androgen going in, 100 estradiol, that's not enough. So they're going to get gyno, or they're going to have increased blood pressure from water retention. Or they're going to have other estrogen side effects like prolactin release, which causes impotence. The bottom line is the safe, effective dose of estrogen is about 40. 30 to 40 is the normal, happy, healthy range. Going above that may not be beneficial and might be harmful to most people, especially HRT people. So that's why nothing is scarier to me as a doctor than the fact that everyone's doing 500 tests as their first cycle. And that's what they do. And it's stupid as fuck, because they always get side effects because they never have enough muscle on their body to handle that much testosterone. So the muscle, it doesn't bind to the muscle, it binds to their hair, their skin, their breast tissue, and they get tons of side effects because they're way overdosing. If they'd use something moderate like 20 milligrams a day or 30 milligrams a day, they'd see a huge benefit. 40 milligrams a day, even 50 milligrams a day. But there's never a reason for someone to use more than 50 or 60 milligrams a day. No way. No way. No way. Not a normal sized human. That they're not going to have enough muscle tissue to absorb. They don't have enough androgen receptors to absorb all of those androgens. That's why you'd use something safer, like Masterone. And I know I keep saying this, and people are like, well, is there anything other than Masterone? I know, right? Why do it the easy way? When you know exactly what the best choice is, well, I don't want to do the best choice. I want to try to do it the wrong way and then convince myself that I'm smart and clever because I'm different. Okay, so let's go through the list. Why not Tren? For fuck's sake. Tren has a whole bunch of side effects. The number one thing is you can't grow if you can't sleep, and you can't sleep on Tren. Tren has like pretty much one application, and that is dieting for a show, and that's preserving muscle while in a calorie deficit. It's not good in the off season. Now, there are people who are going to get so bent out of shape, like, I used Tren and I grew muscle. Fuck Todd Lee, he's wrong. He's like, I'm not talking about you, dipshit. I'm talking about the majority of people will have some side effect from Tren. And because there's no benefit to using Tren over using something safe like Masterone, there's no reason to do it. There's no reason to do it. Just use the safe drug. It's like you could use a sword, or you could use the sword with poison on its handle. It's like, I want to grab the sword with poison on its handle. Why? Because it's cooler. Because all the cool kids grab the sword with poison on their handle. And it's like, what? That doesn't make any sense. It's like, I want to smoke the cigarettes that got extra, have less nicotine, but more carcinogens. Why? It's like, because I'm hardcore. It doesn't make any sense. It's like, you could get 6 cookies for $1, or you could get 1 cookie for $6. Is there a difference in the cookies? Nope. It's like, well, I'm definitely going to buy the 1 cookie for $6. And that's like the Primo thing. It's like you could get Masterone with extra side effects for 3 times the price. And that's Primo. That you have an AI, and you have liver damage, and you have a painful injection site, and it's 3 times the price. Why wouldn't you want it? Well, all the cool kids use Primo. Everybody uses Primo. Primo's the best. Primo means number 1. It's like, it sucks. It fucking blows. It's fucking inferior to Masterone. And if you wanted an AI, EQ's an AI, it's even cheaper than Masterone. It's like, but that's for horses. I'm a human. All right, fine. Please use Primo. Please use Primo. You get in line behind the people who drink Clorox, inject Clorox, and eat Tide Pods. And that will drive down the price of the EQ. And so the smart people like me can buy more EQ and Masterone for cheaper because you are buying the Primo. Buy all the Primo, please. Buy some Primo, buy some Tren. Drive the market down on the good drugs. Oh, yeah, and only use farm-grade GH while you're at it. Yeah, why would you buy the Toyota when you could get the Lexus for twice as much? It's got a different sticker on it. Same fucking car. It's 3 times the price. So why would you ever use cheap GH that's lab tested and proven to be 191 amino acids and 122.146 kilodaltons when you could use the exact same fucking thing because it's a U.S. pharmacy, although they're made in Belgium or they're made in Turkey. They're not made in the U.S. It's just the U.S. company owns the patent, but they're manufactured outside the U.S. So they're not U.S. pharmacies. They're European or Middle Eastern pharmacies that are owned by a U.S. company. And we know how good Pfizer does with all of its other medications. Thank you, Pfizer, for bringing us the greatest thing ever. I can't say any of the actual nouns because we're on YouTube and it's not permitted. So all of you U.S. pharmacy dick suckers who just can't get off the U.S. pharmacy dick, just slobbering away on it, showing how cool you are because the U.S. pharmacies are so great. You're not getting it from the U.S., you're getting it from Europe anyway. And the GH that they buy, they still got from the same place in China. But you're showing off with your designer GH and your designer Primo like a dumb bitch in a Gucci dress with a Prada purse when you could just bought the same fucking thing at Walmart or TJ Maxx for 1/100th the price and it has some other person's name on it. Anyway, so that's that. I guess it's the 4th most important thing is don't blow your money on dumb shit. So number 1, way to improve your life, do your shots every fucking day. Number 2, way to improve your life. If you're going to use test, use GH. If you're going to use GH, use test. Don't run on one leg, use both. I'm not saying you don't have permission. This is just my fucking opinion. Calm the fuck down. We're going to start this over. Number 1, do your shots every fucking day. Your balls make test every day. Your pituitary makes GH every day. Why wouldn't you take it every day? 1A, go intramuscular. 1B, use long-acting drugs because the whole point is to get a flat curve. Okay, flatten the curve. Brought to you by Pfizer. All right, so number 2, use GH because they're synergistic. You want to have the GH amplify the test. You want the test to amplify the GH. That way you can use less drugs. You can use HRT doses and have all the benefits without having any of the drawbacks. It's the same reason why you're going to do it every day is you want less side effects. Number 3, don't use more drugs than you can benefit from. Don't use more test than the estrogen gives you the GH to IGF-1 conversion. That's the whole concept here, is we're not relying on the androgen receptor to build muscle. You probably don't have a lot of androgen receptors. Rely on IGF-1 to build muscle. And I know that this is HRT. Well, you don't need more than a 1500 testosterone to have sex. And so that's usually why guys are doing this. If you run a bunch of tests, you start having side effects. You're not going to have side effects from physiologic doses of test and physiologic doses of GH. People are like, if you use GH, doesn't that mean you got to use insulin? It's like, I don't know. Does every teenager need insulin? If everybody produces GH and it goes down as you age, it means it's highest when you're growing, which is when you're a teenager. Are all the teenagers on insulin? Then why the fuck would you need insulin for a normal amount of GH? Does GH cause cancer? I don't know. Does all the teenagers have cancer? Does testosterone cause prostate cancer? I don't know. Does all the teenagers have prostate cancer? Like, rather than just listening to what dumb fucks say, use your head. Like, if you have a normal, healthy amount of hormones, why would there be consequences to the hormone? Why would you have supernatural amounts of testosterone? I'll use 3 times the amount of testosterone I'm supposed to use, but I won't touch GH. That's dangerous. It's like, I mean, your kids have more GH than you. Is it dangerous? Should you just cut their pituitary out? How the fuck is GH dangerous? Everybody has GH. Doesn't make any sense. Use your head. So, like, I'm on part 3 again. Don't use more gear. Don't use more testosterone than you need to get the DHT and the estradiol you want. If your hair's falling out, you're on too much testosterone. If you got gyno, you're on too much testosterone. Do I take drugs to fix this? No, you fucking lower the drug that's causing the problem. It's like you're so worried about using GH because of the side effects, but you're overdosing on tests, giving yourself hair loss and gyno, and then you want to take more drugs that are even more dangerous to fucking fix it? Like, I'm going to take prostate cancer meds and breast cancer meds to protect me from my overdose on testosterone, but I won't touch GH. GH is the devil, Bobby Boucher. Calm the fuck down. Use your head. Replace your hormones first. Have good, healthy hormones, and then entertain adding the safest, cleanest anabolic steroid you can, which is Masterone. And people are like, but, they're wrong. Masterone is the safest one. Of all the other choices, of the EQ, the Primo, the Nandrolone, Masterone is still the safest one. But Masterone causes your HDL to go down. All of them make your HDL to go down. Stop eating fucking shit. No more fucking saturated fats. Eat like a bodybuilder, chicken and rice. You'll be fine. It's all about LDL anyway, and that's a topic for another video. But seriously, if you need a doctor that's going to guide you and give you the proper HRT, the proper GH, the proper testosterone, and who's wise enough to know when it's safe and what's safe to do, or you're going to some stupid fuck and he's got you on Deca and Test and Anavar and GH and Sermorelin and Ipamorelin and CJC, and you're on a fucking million peptides, but not GH, because that's what he thinks. He thinks he knows what he's doing, but he doesn't know shit from Shinola, and you know he doesn't know shit from Shinola. Come to me. I will save you. I will fix you. I am your answer. Click the link in the description box to get a consult with me, and I will set you straight. I will help you with your hormones. I will help you achieve your goals. Thank you, and may the force be with you.